exams, today's topic is about COVID-19. I will give a brief overview of COVID-19 with an emphasis on testing. This video will also include both molecular tests for diagnosis purposes and antibody tests for study and tracking of the disease. Without further ado, let us get into it. COVID-19 is the name of a disease caused by a virus known as Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. What does COVID-19 stand for? CO stands for Corona, VI stands for virus, D stands for disease, 19 stands for 2019, the year that this virus first discovered in Wuhan, China. Most people infected with SARS-CoV-2 will experience mild to moderate respiratory illness and will be able to recover without much of medical intervention. However, the elderly and people with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer, or people who are immunocompromised could develop serious illness. What makes this virus easily spread and claim the lives of so many people in relatively short amount of time? It is the fact that the virus can easily spread in close contact through saliva droplets from the nose or mouth when talking, coughing, or sneezing. Once a person gets infected, that person can become a host of the virus. The host could continue spreading the virus without having any symptoms for 14 days, and in some cases does not show any symptoms at all. Since the person does not feel sick, the infected individual can continue going about their days and unknowingly infect more people and help the virus to spread even more. The best treatment is prevention, so help protect yourself and those you love by washing your hands, use hand sanitizer often, and avoid touching your face. Limit social gathering and practice social distancing when possible. Don't forget to use facial cover, such as cloth or surgical mask, when you go outside to help limit your exposure. Remember, your immune system may be strong and you can come out of it without any damage. But the people that you may have passed the virus along to may not be as lucky as you are. Elderly and people with underlying disease are more prone to develop a serious medical conditions and can result in death. If you are infected and only experience mild symptoms, please self-isolate. This means maintain distance from other people, even the people in the same households. But what is considered mild symptoms and when you should seek medical attention? World Health Organization, or WHO, has 3 categories for symptoms. Common symptoms like fever, dry cough, and tiredness. Less common symptoms such as body ache and pain, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin or discolorations of finger or toes. Lastly, serious symptoms like difficulty breathing or shortness of breath, chest pains, loss of speech or movement. If you experience symptoms in this group, please seek medical attention immediately. The virus is more concentrated in nose and throat early in the infection phase. But after 5 days of symptoms, the virus tends to be more concentrated in a lower respiratory system. Now, let's move on to the more clinical side of the video, COVID-19 tests. If you have come into a contact with someone who has COVID-19, it is recommended that you get tested between 7 to 10 days post-exposure. It is not recommended to get tested before 5 days because the viral load may be too low to detect and could give a false negative result. This doesn't mean that you should go about your days without isolating yourself from the general public. It is important to self-isolate to limit the spread. Now, when it's time for you to get tested, what are the options available for you? What are the different types of COVID-19 tests available? There are 2 different kinds of clinical tests, molecular tests and antibody tests. Molecular tests, the reason we call this method molecular test is because the test is used to detect the genetic makeup of the virus using laboratory techniques called preliminary chain reactions, or PCR. Molecular test shows if the patient is currently infected with the virus or not. Molecular testing is done by collecting the fluid from nose, throat, lungs, or saliva and sent to the laboratory for PCR testing. Molecular testing is a gold standard used to diagnose COVID-19. Stay tuned for more on PCR in a bit. What can you expect when getting molecular tests? Depending on what type of test, your experience will be a little bit different. Nose or throat swab would be a bit uncomfortable as the long nose swab needs to be inserted into your nose and rotate a few times before removed. The swab is then placed in a collection container containing preservation fluid and transferred to laboratory. Saliva sample is a bit less sensitive but more comfortable for patients. The patient will have to spit into a tube until the saliva reaches the line. The tube is sealed and mixed with preservative solutions before sending it to laboratory for analysis. Specimen storage if unable to send the specimen to laboratory immediately. The specimen should be delivered to laboratory for testing as soon as possible to prevent delay in patient care and the loss of viral infectivity over time. Delay in testing may result in false negative results. If for whatever reason the sample cannot be delivered to laboratory immediately, the specimen should be stored based on manufacturer recommendation to preserve the specimen integrity. If you remember, I mentioned during the specimen collection process, post-collection for both saliva and swab, the specimens are in preservative solutions or transport media. In general, the specimen can be stored up to 24 hours at 15 to 30 degrees Celsius or up to 7 days at 2 to 8 degrees Celsius. What happens when the specimen gets to laboratory? Laboratory checks the specimen to make sure that the specimen meets the standard of collections, meaning that there's no leakage, the specimen is properly labeled, and patient identifiers are on the sample. For the molecular test, the specimens are being prepared for RT-PCR. Some of the testing kits comes with all the reagents preloaded in testing cartridge already. This makes it convenient for the clinical laboratory scientists and make the process much faster. Another benefit is that the cross-contamination between the samples are minimized, since all the reactions are contained in one cartridge. Inside the cartridge is chemicals that will remove the impurities such as tissue, fat, and other proteins to extract and purify virus RNA and other reagents required for DNA synthesis. After the extractions and purifications, the RNA is then ready to be reverse transcribed to DNA and go through many cycles to amplify the targeted DNA. Side note, what is RT-PCR? RT-PCR stands for Reverse Transcription Polymerase Chain Reactions. RT-PCR is a type of PCR. PCR and RT-PCR are a little bit different, but they have the same basic principle. They work by amplifying a DNA segment of interest. This allows a small sample of DNA to be detectable. This way, we only need a small amount of sample from patients who we suspect of having COVID-19 to perform testing. The traditional PCR is only amplifications and detects DNA. This is why scientists develop RT-PCR. This new process allows the detections of virus containing RNA. The process includes adding enzymes and reagents to convert RNA to DNA. This conversions of RNA to DNA is called reverse transcriptions. Then the process continues the same as traditional PCR. Many copies of the virus DNA are made if virus is present. If the virus is present by the end of the process, we should have enough copies of the DNA to be able to detect and the test results would be positive. How to interpret the test results? A positive test result means you have an active infection with the virus that caused COVID-19. A negative test result means you are not likely to infected with COVID-19, but a negative test result does not mean that you will not get infections if you get exposure again. The negative test results only indicate that the patient's not infected with COVID-19 at the time of collection, or the viral loads were too low to detect. Moving on to antibody tests. Antibody tests, also known as serology tests. Currently, FDA and CDC does not recommend antibody tests to diagnose SARS-CoV-2. This test is designed to detect antibodies that is generally generated by the host 1 to 3 weeks after an infection. The antibodies to SARS-CoV-2 becomes detectable in blood for a period of time after infections. Antibody test is not being used as diagnostic test, but it is being used in the study of how the virus spread. There are a few different antibody tests and can be classified to detect either binding or neutralizing antibodies. Binding antibody detection tests use non-live virus purified proteins of SARS-CoV-2 to detect IgG, IgM, and IgA. The test that is used in binding antibodies can be further categorized into two categories: point-of-care tests and laboratory tests. There is a point-of-care instrument that can use a finger stick samples instead of venom puncture, which can be very convenient for healthcare workers for a fast screening. In laboratory settings, we use MSI-linked immunosorbate assays, or ELISA, or chemiluminescence immunoassay, or CIA. Neutralizing antibody detection tests. The FDA has not authorized the use of neutralization tests for SARS-CoV-2. Since it is not FDA approved, I won't go over it in more detail, but I will point out the difference is that this type of test involve live virus. How to determine the test results for antibody tests. A positive antibody test result means that you have likely encountered the coronavirus at some point. A negative antibody test results could mean one of two things. You have not been exposed to coronavirus, or you were exposed to the coronavirus, but the level of antibodies at the time of testing were below detectable level. Thank you for staying with me until the end. What do you want to know next? Do you want to know more about blood bank, chemistry, or microbiology? If you have any burning questions, please feel free to leave me a comment down below. Lastly, if you have not done so, please like, share, subscribe, and click that notification bell. I will see you in the next episode of Blood Talks. And as always, remember, your blood tells you the story of your health. Thanks for watching. Bye!